If schools were to return in Scotland, and you've got to think that this is based on similar scientific advice that we will be getting, and ministers will be getting in London, if under the main estimate north of the border and schools were returned, then you would see the NHS in Scotland no longer able to cope with the capacity, going over capacity, no longer able to cope with the sheer volume of additional COVID-19 cases that would generate. If it's a bit worse than that, then the situation could be dramatically bad. It suggests that in a less optimal situation, making kids go back to school now could result in the capacity being 7.5 times oversubscribed. So really a chilling reminder that we are uncertain about the science and that getting decisions wrong around things like sending kids back to school could have very dramatically negative consequences. Now, it'll be interesting to see at this press conference whether or not Angela McLean agrees with the scientific assessment released by the scientists north of the border. Of course, Nicola Sturgeon relies in part on SAGE, which informs the whole of the United Kingdom. She sits in the COBRA meetings that help determine UK-wide policy, but there is also a Scottish SAGE equivalent, so there is some variance of what scientific advisors say up there. So do those in the UK agree with those in the Scottish government? And then the final thing that we've been hearing this morning was a bit of a beginning of a kind of investigation of how we got to where we got to, with Patrick Vallance, the Chief Scientific Advisor, and Dr. Jenny Harries. And they were being pressed about why we abandoned testing in the middle of March for contact tracing and instead were left all the way through April having to race to catch up again because we went backwards. And previously, Jenny Harries had made the case that, look, contact tracing is simply not the right option for the United Kingdom at this stage in the pandemic because there were so many cases. Contact tracing, unlike South Korea, unlike other countries, was not the right option.
Sam,
but today,
I'm just going to interrupt.
she suggested
Sam,
that actually...
I'm going to interrupt because Dominic Raab is approaching the podium and is about to speak.
And, welcome to today's Downing Street press conference. I'm joined by Professor Angela McLean, Chief Scientific Advisor at the MOD. First, let me give an update on the latest data that we have on coronavirus. And I can report that through the government's ongoing monitoring and testing programme, that as of today, there have now been 1,383,842 tests for coronavirus across the UK, including 84,806 tests yesterday. We know that 194,990 people have tested positive, and that's an increase of 4,406 cases since yesterday. And of those who have tested positive, 29,427 have very sadly died. And our hearts go out to everyone who has lost a loved one throughout the coronavirus challenge. We continue to see evidence of a flattening of the peak of this virus, but as the figures that I've just read out show, it's not over yet. So in the coming days, SAGE will update ministers with their latest scientific advice. And as ever, we will make sure that we continue to be guided by their advice as we take the decisions on next steps in fighting this virus. Alongside the advice that we get from SAGE, our 5 tests remain absolutely key. First, we must continue to boost NHS capacity so that the NHS cannot be overwhelmed. Second, we need to see a sustained and consistent fall in the number of deaths. Thirdly, we must see further reductions in the rate of infection to manageable levels across all different settings and areas. Fourth, we must be confident that the NHS will be able to cope with future demands, including as a result of any changes that we make to existing measures or indeed any new measures that we might wish to take. And fifth, and above all, we need to be confident that any adjustments to the current measures won't risk a second peak of infections that could then overwhelm the NHS. Later on this week, the PM will update the country on the measures and the decisions that we will need to take to protect the NHS, to safeguard the economy and to avoid the risk of a second peak that will be damaging both for public health but also for jobs and the wider economy. And as we consider the decisions that we will take next to protect life but also to protect our way of life, It's now clear that the second phase will be different. We will need to adjust to a new normal where we as a society adapt to safe new ways to work, to travel, to interact, and to go about our daily lives. We've never experienced anything like this first stage of COVID-19 in terms of the scale of the lives lost, but also the lockdown that it has required. And as we go forward, we want to make sure that the next phase is more comfortable, is more sustainable, and prevents lasting damage to jobs and livelihoods. But we need to be under no illusions. The next stage won't be easy. And if we're going to protect life and preserve our way of life, as I just said, we must continue to be guided by the scientific advice we receive and make sure the next steps that we take are sure-footed and sustainable. Now, before I hand over to Angela to run through the data slides, I want to provide an update on one further feature that coronavirus as a challenge has thrown up for this country and indeed for the whole world. Whilst the vast majority of people and countries have come together and rallied to this international mission to defeat coronavirus, there will always be some who seek to exploit a crisis for their own criminal and hostile ends. We know that cyber criminals and other malicious groups are targeting individuals, businesses and other organisations by deploying COVID-19 related scams and phishing emails. And that includes groups that in the cybersecurity world are known as advanced persistent threat groups, sophisticated networks of hackers who try to breach computer systems. And we have clear evidence now that these criminal gangs are actively targeting national and international organisations which are responding to the COVID-19 pandemic, which I have to say makes them particularly dangerous and venal at this time. So we're working with the targets of those attacks, with the potential targets, and with others to make sure that they're aware of the cyber threat and that they can take the steps necessary to protect themselves or at the very least mitigate the harm that could be wrought against them. So with that in mind, today the UK's National Cyber Security Centre and the US Cyber Security and Infrastructure Security Agency have published a joint warning about these groups, and we've offered some advice on the cyber criminals and other actors who are seeking to exploit COVID-19 through malicious cyber activity. Our teams have identified campaigns targeting healthcare bodies, pharmaceutical companies, research organisations, and also various different arms of local government. Now, there are various objectives and motivations